Hello, everybody. My name is Joseph,
And I'm Alexa.
and our presentation is going to be on magnesium and cardiovascular disease. So, what exactly is magnesium? Magnesium is a mineral that is naturally found in the body, in many food products, is available as a dietary supplement, and is present in many medications. The average RDA for most adult men is around 420 milligrams per day, while the average RDA for most women is around 320 milligrams per day. Toxicity levels range from 1,000 milligrams a day or having a serum concentration exceeding 1.74 to 2.61 mmol over liters. Sources for magnesium include many seeds such as pumpkin and chia seeds, almonds, grains such as cereal or bread, and even dietary supplements. Many studies have shown the positive effects magnesium supplements has had on lowering blood pressure, which lowers their overall risk for cardiovascular disease. What is cardiovascular disease exactly? Cardiovascular disease is a leading cause of death among Americans, with one person dying every 34 seconds from cardiovascular disease. Hypertension or high blood pressure is a risk factor for becoming diagnosed with cardiovascular disease. Arrhythmia, also known as irregular heartbeat, is another risk factor for becoming diagnosed with cardiovascular disease. The disease can be prevented by many things, such as physical activity, diet, and even magnesium supplements. And what exactly are magnesium's effects on cardiovascular disease? So currently there are many research studies, and these studies have shown that magnesium supplements actually lower blood pressure. There is a study featuring 545 participants who supplemented 243 to 973 milligrams a day of magnesium, and it showed that only a small amount of magnesium can have a positive effect on blood pressure. The results for the study were that the participants had a drop in blood pressure of about 3 to 4 millimeters of mercury after completing the study, which lasted about 4 weeks. And there was also another study, and they concluded that magnesium supplements can decrease a participant's risk for contracting cardiovascular disease if roughly 350 milligrams of magnesium is supplemented daily.
So, hypomagnesemia is defined as low level of serum magnesium in the blood, which is less than 1.45 milligrams per deciliter, and it commonly occurs in hypertension, stroke, and heart failure. So, arrhythmias. Magnesium has been shown to help with atrial fibrillation and ventricular fibrillation. In a review, there was a meta-analysis randomized control trials on 2,069 patients that were administered magnesium sulfate or magnesium chloride after surgery, and it reduced the risk of supraventricular tachycardia and ventricular arrhythmias. Another meta-analysis showed in 22 studies that consisted over 6,000 participants showed a decreased risk in ventricular arrhythmias when given magnesium sulfate. These results are from the magnesium reducing the overload of calcium and improving ATP production, protecting the myocardium from oxidative damage, and reducing myocardial oxygen consumption. Overall, when magnesium is reduced, it reduces the channels in the heart and induces oxidative stress, which results in the increase in arrhythmias. So, hypertension. Magnesium has an effect on the relaxation of vascular smooth muscle cells and cations vital for blood pressure, which will have an effect on the occurrence of hypertension. There are magnesium ATP-driven sodium-potassium pumps and calcium pumps. When there is a deficiency in magnesium, those pumps cause a depletion in intracellular potassium, and there will be higher levels of sodium and calcium in the smooth muscle and cardiac muscle, which can cause vasoconstriction in the smooth muscles and arteries, leading to hypertension. There is also an increased response for vasoconstrictors like angiotensin II and catecholamines, which occurs in hypomagnesemia. Several studies show promising results for magnesium improving blood pressure. So in conclusion, magnesium reduces arrhythmias by reducing calcium levels and decreases the risk of hypertension by relaxing the heart's muscles and aiding in ion transport. Hypomagnesemia is very common in cardiovascular disease, and supplementation has shown anti-inflammatory and antioxidant properties in individuals without and with magnesium deficiency. And these are our references. Thank you.
Thank you.